This patient and his wife have been on my mind. I've been thinking about this since I saw him, and I wanted to tell you about it. And I'm going to tell it over the next few weeks. I'm going to kind of break it into parts because there's a lot to it. They were an elderly couple. I honestly, I don't remember how old he was, maybe 70. And she took care of him, and she brought him in because he was weak and she thought he was confused. And so the first thing that I want to talk about today is in the ER, things that I commonly see that would make sense in this. So like what was really going on with this guy? That's the thing that I want us to like think through, what was really going on with him. And I kind of want to walk you through the medicine of it. But then in the following weeks after that, I want to talk about how this guy reminded me of my own grandfather and how he had suffered a stroke and a cardiac arrest and how he was very different after that and how that was hard on the family, including me and my father and grandmother and all of us, and how we struggled with that. And then this is going to be a hard thing, but I think helpful for a lot of people to hear, which is sometimes we can't fix things. Sometimes there is, I don't want to say nothing wrong, but sometimes there's not much we can do. And that's okay. So let's talk about him because this is a little bit interesting. So, he was 70, and the story that I got when he came in was that he was confused and he was weak, like generally weak. Normally he could get out of bed. Now he couldn't get out of bed as much. He wasn't able to get to the side of the bed and push off. And he wasn't mentally as alert as he normally was, so he would normally interact. He would say a little more. His speech had changed. Some of these things can be very subtle. And the caregiver, in this case his wife, is usually the one that knows, they know them the best, and they can tell you what's going on. So I want you to kind of think, what's really going on with this guy? If we can get to the bottom of it. So I go in and I see him and I talk to her, and he doesn't speak very much, and he does have old stroke symptoms. So he had a little bit of a kind of a slurred speech thing, couldn't speak very well. You could tell that he had a form of dementia. His memory was not very sharp. And on one side, he had weakness. So his left side, his left leg and his left arm were weaker than normal. So that kind of, told me, okay, this guy has had a stroke in the past. Doesn't look like anything had changed. I didn't think he had a new stroke. Sometimes people can have a new stroke and be confused, but usually that's not how it happens. But something was a little bit of a red flag, and I was like, he was a little more demented. Sometimes people can have isolated, they'll have a stroke and they'll just have speech stuff, or they'll just have weakness stuff, but usually unless it's a massive stroke, it doesn't change, their personality or their memory. It can, but I'm just talking in general. So I got a little curious about that. I was like, what's going on with this guy? Why is that the case? And then some of his medications also didn't fit with that. So I kind of talked to her a little bit more, and actually, now that I'm remembering it, this guy was in his 60s, so he was young for someone to have had a stroke. That was also a red flag. I'm like, this didn't make sense. So I kind of talked to her more, and I get into it more, and they had been married for maybe 15 or 20 years, not terribly long, so they got married a little bit later in life, and shortly after they got married, he had been working in construction or in the fields, I don't remember, and he had fallen and had a bleed in his brain from when his head hit the ground, and then he had bleeding in his brain, and that bleeding had led to a stroke-like syndrome, and it was in that where he had lost some executive function, some of his personality and his memory, ability to form new memories and this kind of stuff. So I was like, oh, okay, because that didn't fit together initially. Okay, so that's the setting, right? He had a bleed before, and then after that, he also had a stroke later that gave him the weakness and the slurred speech stuff. So these are two different things. So the first thing that I want to talk about is to kind of sort this out. Is these both would be considered strokes. The way I explain what is a stroke? The way I explain that is, I think we know what a heart attack is. An artery in your heart is blocked, and part of your heart doesn't get blood. And when that part of your heart, let's just say like the left bottom quarter, that's not how we talk about it, but let's just say part of your heart doesn't get blood, literally those heart cells die because that artery is blocked. And then afterwards, instead of pumping like this, the heart only kind of pumps like this maybe, especially on that side. So a heart attack is when heart cells die in a certain spot because they don't get blood. A stroke is it's a very similar thing, but it happens in the brain, where brain cells die because they don't get blood. So in the same way that it can be a clogged artery in the heart, it can be a clogged artery in the brain, and when they don't get blood, that causes a stroke. Okay, that's one kind of stroke. And that can either happen because a clot forms all of a sudden, or a clot can shoot from the heart, for example, into the brain and cause a blockage. That's the blockage side. And those are certain kind of strokes. There's another kind of stroke, so instead of blockage, where it's bleeding. So there's two kinds of stroke. And what was interesting is that this guy had had both of them. First, he had had bleeding. And so what happens with bleeding is an artery tears, ruptures, blood, instead of going to the part of the brain it needs to, goes outside the artery. And in the same way, those brain cells don't get the blood that they need. And in the same way as a heart attack or other kinds of stroke, they die. And so a stroke is where part of the brain cells die. And depending on where it happens in the brain, determines what it affects. For example, there's parts of the brain that are involved in speech. And if you have brain cells that die along those tracks, then it will affect speech. Same thing if it's a large artery in the brain and it's usually the opposite side. So a stroke on the right is going to affect your motor function on the left. Anyway, the point is, depending in the brain on where the stroke is, that determines how it affects, what the permanent effects of it are. Okay? So two different kinds of strokes. Is it bleeding or is it a clot? If it's bleeding, is there a lot we can do about it? No. There's really not a lot we can do. We can try to stop the bleeding, control the blood pressure. If they're on blood thinners, we can reverse that. If it gets super serious, they can go to a neurosurgeon and have surgery to kind of deal with bleeding. But most of the time with that, the damage is done, and it's a matter of seeing, what is somebody going to recover in time. A clot, on the other hand, if you get a clot that develops in there and you get slurred speech, droop on one side, or weakness in your arm and leg, go to the ER immediately, right away. Because there's medicines we can do and there's things we can do to open that up and get that blood flow back to the brain and reverse what's happened. The window is 3 hours, but as soon as possible. I couldn't tell you how many patients I've had who come into the ER 2 days later, a couple days later, they thought it would go away, and by then, the damage is done, and there's not nearly as much as we can do as if they would have come in right away. Maybe we can give a clot buster medication, maybe we can get them to a hospital where they can literally go up through the artery, pull that clot out, and restore the blood flow and prevent all the damage. So this guy comes in, let's bring it back to this guy, because he had had both of those things. So he comes in, and he was complaining of weakness and kind of confusion, altered mental status. Well, is it weakness where it's like one-sided weakness? That would make me worried about a stroke. No, it was just kind of like body weak all over, that's a huge bunch of possibilities. He could be dehydrated. His sodium could be low. He could just not be eating. Maybe he didn't sleep well. He could have a urine infection or pneumonia or some other infection. Probably not a stroke, right? He could be depressed. There's all these possibilities. And so I kind of took a look at him, and I didn't see anything that looked like a new stroke. So I kind of took that stroke stuff, put that as less likely, probably still need to do the CAT scan. And I thought, well, we need to see, does he have a urine infection? Are his electrolytes okay? Low sodium can cause this. Kidney failure could cause this. Dehydration could cause this. Does he have an infection? All that kind of stuff, right? So the long or the short of it is, um, I run these tests and I end up finding something. His sodium's a little low. He's a little dehydrated. He's got some kidney failure. Probably hasn't been drinking enough water. For most young people, water doesn't really matter. It's kind of a placebo. I don't think it's as big of a deal as everybody's like. I have people come in all the time and they're like, well, I'm drinking a lot of water. I'm like, great, but it doesn't really matter, But for this old guy, they get so dehydrated that it really does make a difference. And I'm talking like 70s, 80s, 90s. That's when fluid intake really matters. And you can see it in terms of weakness and altered mental status and all these kind of things that it can cause. So we found something, He had these kind of minor abnormalities, may need to stay in the hospital, get fluids. That might make him feel a little better. This is where I want to kind of conclude this one for this week, just in talking about stroke and the causes of weakness and stuff like this, to work through this with you. But I want to leave it here for the next week because I don't think that's what was really going on with him, and I don't think that's why she really brought him in. There's other reasons why I think she really brought him in. I'm going to get to that next week in the thing. I'm leaving you a little teaser so that you'll open that next email and get into it. But I really want to unpack more what was going on between the two of them, her as his caregiver and wife. I mean, don't forget, this lady was only with him a couple years before he suffered this stroke. I really admired how she had stayed with him and was at his bedside. Really loved this man. And a lot of the stuff that she had to put up with. So I think I was suspicious. I was like, I think that's really what's going on. So I'm going to talk about that next week. But let's just summarize all this stuff. Remember, strokes are where brain tissue dies. It can be either from a clot or from a bleed. And then when it comes to weakness, if it's weakness on one side, you're thinking about a stroke, go to the ER immediately because we can do something about that to open that clot. And if it's just generalized weakness, there's so many different causes of that. Start hydrating. That's the first thing I would do if you're elderly and you're feeling really weak. Eat well, hydrate, do the basics, get rest. You always go into your doctor when you need. I will see you next week to continue this story.